Good morning and welcome. My name is Morgan Morris and I am working in the Pharmacy Department in the Broken Hill Health Service.
I'm Denise McCallum, I'm the Essentials of Care Coordinator for Far West Local Health District.
This morning, myself and Denise will be talking to you about the enhancements made to the roles of both the pharmacist and the pharmacy technician in response to positive patient stories.
So who are we? Far West Local Health District covers one of the largest geographical areas in New South Wales. We have a sparsely populated area, but we actually border on the Queensland, South Australian and Victoria border, and our pharmacy department is responsible for providing both the inpatient and outpatient services to all the facilities within this health district. So that's like Tibooburra, Wilcannia, White Cliffs, Wentworth, Dareton, Balranald, Ivanhoe, Menindee, and hopefully I've forgotten no one.
We're a small but dedicated team consisting of 2 full-time pharmacists, 2 full-time pharmacy technicians, 2 full-time pharmacy assistants and 1 part-time pharmacy intern. Our whole team is based in the Broken Hill department.
So why did the pharmacy department want to take on Essentials of Care? The pharmacy department, as we said in the last slide, is a very small unit and had been, some of the members been together for quite a long time. And they'd been thinking about the way that they'd been practicing and what they wanted to do. So this was a great opportunity that they chose to do for them to have a chance to really reflect on their current workplace culture and clinical practices, for a chance to them to find out what the experiences that the patients and staff and other consumers of their service are currently feeling and to improve upon them, to improve patient care, and also an opportunity for them to develop improvements and efficiencies in their current service delivery.
Implementing EOC also helped the pharmacy department to work together to put together a list of team values. This gave the staff a chance to speak up about what they valued the most and how they would like their workplace to be. Throughout collecting stories from a diverse group of customers, including inpatients and outpatient units, remote facility staff and discharged patients, the pharmacy department became more aware of the impact and influence we as a service had upon our patients' journey.
On the slide you can see that there's a poster to the side. One of the things that came out of a number of the stories was that a lot of the units and departments across the facility didn't quite understand how small the team was, how much what services they provided across the whole facility, and how requests for one type of service from the department impacted upon them being able to deliver another. For example, if someone wanted discharge drugs by 10 o'clock in the morning, if new patients came through, the same pharmacist that did the inpatient units discharges also was responsible for supplying all the medications to the inpatient unit. That was one pharmacist, so they couldn't do 2 separate roles at the same time. So what led to the enhancements? The patient stories that we collected, as Morgan said, weren't just from inpatients that had been discharged. They were also from the inpatient unit staff, the remote facility staff, and some of the outpatients departments. And we used those stories to really find out what their experience was when they were interacting with the pharmacy department. Was there anything that we did really well, anything that we needed to improve? And it was really quite pleasant and exciting to hear some of the really positive patient stories. One lady that we got a story of had actually been in the facility twice over the last 12 months, and we didn't think that we did discharge medications as well as obviously what this lady did, that she didn't have any problems, and the impact that the pharmacist did have on her during her stay was quite significant. She really didn't understand her pain medications. She was a little confused from the times that the doctors were telling her to take the medications. It was different when she was taking them at home, and it wasn't working for her. When the pharmacist sat down with her and had a really good conversation, asked her what she was on, how she was taking them, what was going on, he then helped her understand why they need to be spaced apart so much, how to take the breakthrough medication in between hand. And it had a huge impact on her life, not only in hospital, but actually once she was discharged. And when we contacted her, she was so thankful for what he had done, because she could actually get on with her life and plan her days and have quite a good quality of life, even though she lived with chronic pain, because she was now able to manage and understand her medications. As you can see from that slide, there's quite a number of the the responses we got were in regard to pain management, and the fact that the pharmacist actually sat down and spent the time with them to have those discussions and find out what they were on, how they were doing it, what was happening in their life as well. The wards, one of the responses from one of the inpatient units was that having the pharmacist on the floor and asking him, or having access to him, to get some consultation in regard to clinical pharmacy to do with patients or dilemmas actually helped them to understand and had the confidence to sometimes challenge a medical officer over the times or why they were staggering medications away, or this was the way that the organisation wants them staggered and why in regard to the management of their medications. The positive stories have provided the baseline for the unit to actually go forward, but they were looking at wanting to enhance the role of the pharmacist and pharmacy technician, but this was the real catalyst, the stories, to actually give them the courage to go forward and also make this a priority for them to actually go, okay, what can the pharmacy technician take on that can release our pharmacist so they have more time to have that clinical pharmacy time with the patients in the ward and have that impact upon the patients and the staff. Prior to the roles changing, as you can see, this is not their whole job list, but this is some of the roles that were previously undertaken by both the pharmacist and the pharmacy technician. The pharmacist had quite a significant technical tasks were orientated to him at that time, and he was responsible for the training and development of the pharmacy technicians. The pharmacy technicians, as you can see, did a lot of the packing and dispensing of the pharmacy supplies to the remote facilities and outside institutions. They also were responsible for maintaining and monitoring the dispensary stock and unpacking deliveries. They also maintained the impress supplies to the hospital, prepared accounts, were our customer service, did the clerical duties, and did the preparation of the monthly reporting requirements.
As you can see by the previous slide, both the roles of the pharmacist and the pharmacy technician have changed dramatically, with the technician being given more roles based on the ward, greater dispensing duties, and a chance to use their skills gained from training courses. This in turn has freed up the pharmacist from dispensing so they can perform more clinical duties, and also given them the chance to build stronger, better relationships with the doctors, nurses, patients and pharmacy staff. The graph highlights the positive effects of changes from the EOC, with the figures from 2012 pre-EOC showing the pharmacist dispensed the same amount of prescriptions as the pharmacy technician. Due to the pharmacist dispensing the same amount as the technicians, this meant the pharmacist had less time available to spend with the patients to counsel them, and less time available to conduct clinical ward rounds on the ward. The recent figures drawn show an incredible decrease in the amount dispensed by the pharmacist and a massive increase in the amount dispensed by the pharmacy technician.
So what has been the impact of the role enhancement on the pharmacist? As the last slide showed, there's been quite a dramatic shift from technical tasks to actually the opportunity to be engaged in clinical pharmacy, whether that's one-on-one with a patient or being available to the medical and nursing staff in consultation with them. It's increased the opportunity to do the clinical reviews, and the pharmacist has had a greater engagement with the pharmacy team, both the nursing and medical staff. There's been a shift towards increasing their managerial tasks and a great reduction in their technical tasks.
The impact of the role enhancements on the pharmacy technician meant increased job satisfaction, increased responsibilities, increased communication with the medical and surgical inpatient unit nursing staffs and medical teams, greater opportunity to use skills, reduced doses to inpatient or medical and surgical units, greater control of medication storage, reduction in lost medication with wards taking greater accountability with the introduction of ward tracking handover forms, opportunity for troubleshooting and tailoring the service to suit the unit's needs.
So the impact on the medical and surgical unit's been quite significant. Previously, they weren't sure who was going to be coming up, what time they were going to be coming up, or how they'd actually be serviced. Now they know exactly which pharmacy technician will be coming up, what their roles are, how they can be engaged. They know if they want to query anything, that they can speak to them and contact, and who to ring pharmacy department and speak to. They also know that the pharmacist is going to be available so that they can follow up with them in regard to anything, or if there's something that they really want them to be on the ward round or have some input in, they can capture them that way. There's been a reduction in missed doses with having the pharmacy presence greater by both the pharmacy technician and the pharmacist. There's access to the medications, so it's not 4 o'clock in the afternoon, a new medication, the chart hasn't come down. The pharmacy technician is up there in the morning reviewing the charts. Any new patients that have been admitted with new medication needs are identified, and that's dealt with in a much more timely manner. There's also been a greater communication and networking between the pharmacy department and the inpatient units, both the medical and surgical units. These are the 2 units that we've initially rolled this out into, and the anecdotal responses we've got back from a number of staff, not just the nurse unit managers but team leaders and even staff on the floor, is that they know who to contact, they know when medications are coming up, they know that there's someone around. And the medical and surgical staff now have a greater understanding of the pharmacy department, what some of their roles are, some of the processes are, and also their IMPRESS stock, why they've got that certain type of medications for their IMPRESS, how often that gets reviewed and how often it gets restocked. So where to from here? So from now, we're doing the enhanced roles of the pharmacist and pharmacy technician have given us the opportunity to even look at developing the pharmacy technician role even further. There's great scope and opportunity to do that. There's also the opportunity that's come up for us to start implementing some of this on other units. So 2 other units are now starting to utilise the pharmacy technician to almost the scope that Morgan's doing in 2 other units. And there's also the potential for the unit itself to start looking at other ways that they can look at themselves, refine their services and their service delivery. They've done a number of things other than just enhancing the role. They've also looked at their internal processes within that department by the physical structures, just moving that around to changing it, to making it more conductive for them to work together, because one of the things they felt was that they were disjointed within that department because of the physical space. And just moving some shelves around and opening that out has actually made them communicate a lot better, a team, and work together better. The other thing that we're doing is we're doing some ongoing evaluation. We're currently going through another round of collecting stories from our patients and our inpatient staff on their experience with the pharmacy department, how they felt we impacted on their journey, and was there anything that we could improve, and undertaking in the near future some more observational studies as well. But thank you very much.